So dentures are a procedure that any dentist can do, and there are many dentists in the surrounding area that do dentures. The difference here at Gundersen is that as a prosthodontist, I've received extra training in dealing with the more complex situations. And so one of the things that will determine the success of a denture is the patient having adequate bone structure to support the denture. But some people who have been without their teeth for a long period of time, or some people who have lost their teeth due to periodontal disease, they may have a lot less bone in their mouth to provide the support for the denture. So in a situation where you don't have an adequate amount of bone, you're going to struggle significantly more in a denture than the average person. And so as a prosthodontist, I have received additional training in dealing with these more difficult environments. So people that have had a denture made by their dentist and they're struggling with it due to lack of bone or lack of retention in the denture, sometimes they're looking for an alternative. And as their dentist recognizes some of these anatomical challenges, they might refer their patient to a prosthodontist to have somebody who's a little bit more familiar with the little tips and tricks that help along the way. Sometimes the only answer for people that are struggling in a more conventional denture is to have dental implants placed. So dental implants are a small titanium screw-like device that the oral surgeon or the periodontist can place down into the patient's jaw, and after an adequate amount of healing time, we can then attach their denture to those implants. And so at that point, you're relying on the implants for the support and the retention of your denture. And so maxillary dentures, they tend to work very well for patients. With a maxillary denture, you can achieve a suction against the roof of the mouth. And with that suction, the denture stays in fairly well. It's the mandibular dentures, these lower dentures, that patients tend to struggle with most of the time. And it's in these lower dentures that the standard of care is going towards using dental implants to help retain that denture. Otherwise, the only thing that holds a lower denture down is gravity and the patient's tongue. And having bone helps with the situation because it provides support as the patient's kind of chewing from side to side. But for these people that don't have bone and they've lost so much of their bone, they're not going to have that stability. So it's either they just get used to the lack of stability, or dental implants are really becoming a very convenient way of getting back that support and that stability. We make denture, we offer a lot of variety for people that have lost all their teeth. We can make a traditional denture. We can make a denture that still comes out of the mouth at night, but when it's in, it snaps into place right onto those implants. And then we also make a denture that is fixed in the patient's mouth and they cannot take it out. It is completely supported by implants. You would need more implants in that situation if you're going to have the denture fully supported on the implants. But those are, they're great. A lot of people are satisfied with their denture and they don't feel they need anything more. But we have seen in our practice where we have a wide variety of people that have the dentures and people that have the overdentures and people that have the hybrid prostheses. As I talk to these patients, and some of them have just recently had their new appliance, some of them have been in it for decades. And as I talk to these patients, you can see that people are satisfied with their dentures, but people are even more satisfied when they have a couple implants to snap that denture onto. They really talk about those benefits with you. And the people that have the denture that is fixed in the mouth and that does not come out, what we call a hybrid prosthesis, patients are just really appreciative to have that ability to have teeth again that are solid and that don't move around.